So good evening everyone. Welcome to One Shot series. Today's topic is forensic traumatology. In forensic traumatology, one very commonly asked topic in your exam is grievous hurt. What is grievous hurt? What are the clauses of grievous hurt? And related MCQs are commonly asked in NEET PG, INICET exam and also in your prof exam. Yes. So good evening all. Audio video, is it clear? Yes. Dhananjay M, good evening. Rakesh, good evening. What is hurt? What is grievous hurt? The punishment and related MCQs we are going to discuss in next 30 minutes. Okay? Yes. Gore agat karna. That is section 116 BNS. So whenever question asked, grievous hurt defined under 116 BNS. Voluntarily causing grievous hurt punishable under 117 BNS. One more MCQ, 118. That is causing grievous hurt by using dangerous weapon. So 3 MCQs, I'll repeat again. 116 BNS, that is definition of grievous hurt. 117, voluntarily causing grievous hurt, that is gore agat karna. 118, the same grievous hurt when it is caused by dangerous weapon. The dangerous weapon means any cutting, shooting, or any firearm, corrosive substance, animals. That is basically known as dangerous weapon. Yes, 8 clauses are there. Okay, so let's see what are 8 clauses of grievous hurt. Before that, so let me summarize few important BNSs and BNS. Yaad rakhna, 114 is hurt. So all of you write in the chat box, 114 is equal to hurt. 115 voluntarily causing hurt. So try to understand the definition of hurt. In general, simple hurt, that is 114 BNS. The same thing, voluntarily causing simple hurt, that is 115 BNS. Okay, very commonly asked in the exam. 116 क्या है? That is grievous hurt. 117 voluntarily causing grievous hurt, VGH. 118 the grievous hurt caused by dangerous weapon. So D for dangerous weapon. This is very, very important. Okay. There are 8 clauses are there in 116, like emasculation, permanent privation of sight of either eye, permanent privation of hearing of either ear, privation of member or joint, like that. There are 8 clauses are there. This can be MCQ. The clause number 1, remember, emasculation. Emasculation. The emasculation is, that is inability to do sexual intercourse in male. So this word emasculation, this clause basically related to only males. This can be asked in Viva. So only applicable to males. Like example, amputation of penis. So that can be grievous hurt. That comes under clause number 1, emasculation. Or damage to lumbar vertebra or the spinal cord leading to impotence. So this is basically impotence also. As you know, the erection mediated by parasympathetic system, ejaculation mediated by sympathetic system. When there is a damage to the lumbar vertebra, damage to the sympathetic parasympathetic system, that can lead to inability to do sexual intercourse, that we call it as impotence. Impotency due to trauma can be emasculation. So this is one very commonly asked Viva question. This is class number 1. The class number 2, permanent privation of sight of either eye. Here the important word is permanent. Remember, it is not temporary. Permanent. So it leads to permanent loss of vision during natural course. Privation. The meaning of privation is the loss. Sight. The sight means basically the vision. As in normal vision is 6/6. Either eye. So right eye or left eye. Not the both the eye. So that is the second clause. You can remember 2 eyes, that is second clause. Example, gouging out of eyes, poking out of eyes. And remember, it does not mean it is incurable. It can be curable also. The definition of grievous hurt, that is basically the inability during natural course. Whether it is reversible, irreversible, whether treatable, curable, incurable, doesn't matter. During natural course, if it causes permanent privation of sight of either eye, it can be grievous hurt. So this is the clause number 2. The clause number 3, permanent privation of hearing of either ear. Again the same meaning, permanent, that is not temporary, privation, that is the loss, either ear, right or left ear. As you know, ear that consists of 3 parts, that is outer ear, middle ear, inner ear. So third class is basically that is related to the ear. One example is damage to tympanic membrane. The tympanic membrane is a part of outer ear. When there is a perforation, that can lead to deafness. Again, it doesn't mean that it is incurable. Okay? So this is the clause number 3. Then the clause number 4, privation of any member or joint. This is very important. The fourth one, that is related to member. Any member or joint. Can you give one example for member? Yes, guys? Yes, Dhananjay, Rakesh, Cricket. Can you give an example for member of the body? The student, they give example liver, spleen, brain and all. So that is not the best example. The member means any organ or the limb capable of performing distinct function. One good example that you can answer in exam, that is thumb. The thumb is a member of the body. When there is an amputation of thumb, that can be grievous hurt. The punishment is 7 years of imprisonment. If simple hurt, 1 year of imprisonment. This is what we define in injury certificate, whether it is simple hurt or grievous hurt. And also the weapon, whether it is caused by blunt weapon or by the sharp weapon. Blunt weapon example, abrasion, bruise, laceration. The sharp weapon example, incised wound and stab wound. Dangerous weapon, so that is given in 118 BNS. Member example is thumb. Hip joint, okay. Okay, hip joint, yeah, the joint mentioned, it can be a privation of joint, yes. Any joint in the body, even small joint also. Metacarpophalangeal joint, any joint, that can be grievous hurt. So, there are 8 clauses. The number 1, that is emasculation. The second thing is permanent privation of sight of either eye. Third one, permanent privation of hearing of either ear. So, and the fourth one is the member. You can see here. So, what is the finding there? The finding here is that tympanic membrane that shows perforation. So it can be grievous hurt. And one more image there, the image that is showing the loss of member. At the same time, yeah. Yes, good. The fifth clause, destruction or permanent impairing of powers of any member or joint. The clause number 5, that is related to the power. The power of any member. Member can be upper limb, lower limb, or joint due to the trauma, due to the assault. Okay? Example, the dislocation of hip, or destruction of the hip joint, or destruction of the knee joint as a result of road traffic accident, destruction of knee joint as a result of assault, or one more example, stricture due to burn. So when there are strictures are there over the limb, so because of the strictures, when person is unable to move his limb, when there is a permanent impairing of power of member or joint, then it can be grievous hurt. So that is the fifth clause. Remember, fifth clause is, that is basically the fist, that is power star like that. So yes, Manjunath. The sixth one, you can remember sixth sense, the permanent disfiguration of head or face. Like example, cutting of nose. So nose is an important component of the body. It is also member. When there is a cutting of nose, there can be disfiguration, or cutting of the ear. That is the best example. Remember, the vitriolage or acid attack, now it comes under another section that is known as 124 BNS. So the best example for the sixth clause is cutting of nose or the ear. The vitriolage is punishable under 124 BNS. So all of you write vitriolage is equal to 124 BNS. Keep writing few points, guys. The vitriolage means oil of vitriol, that is basically sulfuric acid. The throwing acid over the face, that can lead to severe burn, which causes coagulative necrosis, which causes disfiguration of face, one of the heinous crime. So we have separate section for that, that is 124 BNS. The punishment can be life imprisonment. Okay? Previously 326A and B. Now it is 124 Bharatiya Nyaya Sanhita. Yes, good answer, good. Dhananjay and Dia, good. Chalo ho gaya. Sixth one, sixth sense, that is the face and the head or face, not the neck. Then the seventh clause, fracture or dislocation of bone, like example radius bone, ulna bone, or the tooth. The dislocation of tooth can be grievous hurt. But remember, mere looseness of teeth is not dislocation. Just a loose tooth is not equal to dislocation. So that is as per 116 BNS. fracture. The fracture can be outer fracture, or it can be inner table fracture of the skull. Even inner table fracture, hairline fracture can be grievous hurt. So this is seventh. The seventh related to fracture dislocation. The very important one, the common one, very commonly asked in the exam, the common area you tend to do mistake is the eighth clause. In the eighth clause, we have like this: any hurt which endangers life, or we can call it as dangerous injury. Like example, head injury is a dangerous injury. Stab injury over the abdomen endangers life. So any hurt, example, stab injury over abdomen, or head injury, or stab injury over the neck, piercing platysma, definitely dangerous because we have carotid arteries, jugular veins, which can bleed and lead to shock and hemorrhage and death. So they are example for endangers life. Or which causes sufferer to be during space of 15 days severe bodily pain, or any injury which causes severe bodily pain, so that the person is unable to do his ordinary pursuit for about 15 days. It is 15 days, not 21 days, not 20 days. It is 15 days. So all of you write in the chat box, 8th clause is equal to 15 days. Previously it was 20 days. Now it is decreased. Okay? Keep writing this point. Ordinary pursuit. What do you mean by ordinary pursuit? Ordinary pursuit means ordinary activities. Like example, having food is basically ordinary pursuit. Brushing teeth, ordinary pursuit. Going to toilet, buttoning, unbuttoning shirt. Ordinary pursuit is not related to any profession. It is basically the ordinary act of the person that you need to record as a doctor. Sometimes even a video recording also done in this particular case. So there are 8 clauses. The 8th clause is a bit difficult one. Just remember, endangers life, severe bodily pain, unable to do ordinary pursuit for about 15 days. Ordinary matlab day-to-day activities, not the professional work. Applying leave for 15 days is not grievous hurt. Say example, someone like driver applying leave for 15 days, staying in hospital, and that is not grievous hurt. It is not related to any profession. Is it clear? All the 8 clauses, guys? Fine. Diya Sudhir? Yes. Chalo. Now, so try to understand this image. So this image, you can see here, cut, incised wound over the face can be grievous hurt. And one more picture, you can see there the picture. In the picture, there is a burn contracture. The burn contracture can be grievous hurt. And in one more picture, you can see here, there is a fracture of both the radius and ulna. The fracture comes under 7th clause. And inability to do ordinary pursuit. That is the 8th clause. I hope this is clear. Rakesh, Diya and others? Yes, that's great. So now let's start some important NEET PG INICET questions based on this. I'll just repeat. 114, 115, 116, 117, 118 frequently asked. Okay? And this is also asked, what is 114? 114 is hurt. Whoever causes bodily pain, disease, or infirmity. Infirmity means illness to any person is said to cause hurt, bodily pain, disease, infirmity. So basically BDI is equal to hurt is equal to 114. B मतलब bodily pain है, D मतलब disease है, infirmity मतलब illness है, inability है. All of you write in the chat box BDI लिखो. So gore आघात करना, that is basically grievous hurt. Yes, चलो हो गया. Now NEET PG INICET question. Good. So this is the first question asked. A 25-year-old person developed right corneal opacity. Corneal opacity is definitely a grievous hurt. Following injury to the eye, corneoplasty of right eye was done. Vision was restored. Medico-legally, such injury is corneoplasty was done and his vision was restored. Now his vision is normal. So such injury is grievous, simple, dangerous, serious. Try this. Try, all of you. I said it is a natural course that decides the grievous hurt. Whether it is simple hurt or grievous hurt, it all depends on the natural course. It is not related to curability, surgical treatment or medical treatment. So still it is. Okay? So what is the best answer? The answer is grievous hurt. Nothing to do with the treatment. Still it is grievous hurt. Because corneoplasty is not natural course. The corneoplasty is an intervention, the surgical intervention. So that is not included in 116 BNS. So here the punishment can be 7 years of imprisonment. Simple hurt, already I said 114 and 115 BNS में आता है. Grievous hurt आता है 116 and 117 BNS. There is nothing called dangerous injury, but there is a dangerous weapon or the act which endangers life. वो सब लिखा कहाँ पे लिखा है? धारा 118 BNS. Serious injury? No, legally not defined. So answer है A is the answer. Yes, मैंने देता. Second question. Teacher slaps a student like this slap, which results in permanent deafness. The injury is. Very simple question. So probably there is a tympanic membrane rupture or damage to the middle ear or can be damage to the inner ear, especially labyrinthine. So when there is a damage to that, it leads to deafness. So that comes under clause number 3. Answer है grievous injury. Simple hurt नहीं है, dangerous. No, it is not dangerous. So being a teacher, it is not illegal act. No, definitely illegal act है. So the beating student is definitely illegal hai. So answer is B. Clause number 3, correct answer, Dhananjay, great. The components of injury certificate are all except. Injury certificate मतलब wound certificate. Except लिखा है. Details of injury. Details of injury means whether it is abrasion or bruise. So details मतलब क्या है? Abrasion है, bruise, laceration, stab wound or incised wound. and the size, the length, breadth, width, or sometimes depth also. In stab wound and incised wound, whether it is skin deep, muscle deep, bone deep. So details of injury is known as body of injury certificate. Important component. Nature of injury, simple or grievous? Yes. This is also component hai. Age of injury? Yes. Depending upon the color changes. So in bruise, the mnemonic is RBBGY. When injury is fresh, red in color. Okay, then it becomes blue in color. Then it becomes brown in color, green in color, yellow in color, like that. So age of injury, depending upon the color, very important. Exact manner of injury. ठीक है, आंसर क्या है? Exact manner is wrong. So exact manner, we can give comment on the exact manner, but exact manner, it all depends on the investigation. So the investigation will definitely help the judiciary to find out the exact manner. Manner matlab suicide or homicide or accidental or judicial. So answer is D. Even D is also correct, but D is the best answer in this. Good. Chal, ho gaya. Next. Then a question from traumatology, some new question, guys. A woman arrived at the emergency with a long bone fracture. Long bone fracture means femur fracture. Few hours back with the complaints of breathlessness, petechial rashes all over the chest. The probable diagnosis is INICET question. So here क्या लिखा है? Breathlessness है, breathlessness, एक है रैश है, रोड ट्रैफिक एक्सीडेंट है, फ्रैक्चर ऑफ फीमर लिखा है. So when it is given, it is not amniotic fluid embolism. Amniotic fluid embolism is very common in case of criminal abortion. As you know, criminal abortion punishable under 88, 89, 90 BNS. नहीं हो सकता है. Ear embolism, rash and all very uncommon. Ear embolism भी नहीं है. Either it can be fat embolism. Yes, it's not pulmonary embolism. The best answer is it's a fat embolism. B is the correct answer. B, fat embolism. Yes, Dhananjay, very good. 88, 89, 90 BNS. 88 मतलब criminal abortion with consent. 89 criminal abortion without consent. 90 criminal abortion leading to death of the female. So याद रखना पड़ेगा fat embolism. Can anyone tell me what is the cavity that is opened first in case of ear embolism? What is the first cavity to be opened in ear embolism? Can anyone answer this question? In ear embolism, the following cavity is opened first. Option A है cranial cavity, thoracic cavity, abdominal cavity, pelvic cavity. What is the cavity that is opened in ear embolism? The point number 1. And what is the test for ear embolism? याद रखना पड़ेगा, ear embolism, the first cavity should be cranial cavity. And the test done is pyrogallol test. Very commonly asked. ठीक है? Pyrogallol test. No, beta, it is the cranial cavity. So nobody has answered. That's okay. So it's that is in case of basically pneumothorax. Gas in the water. बेटा वो pneumothorax में आता है. ये air embolism है. Air embolism in the brain is definitely fatal है. It can lead to death of the person. Pyrogallol test. Then it is punishable under. So very famous movie that is related to Vitriolage. You can see here ऑप्शंस 116 लिखा है, 106 लिखा है, 124 लिखा है एंड 103। धारा 103 मर्डर है। मर्डर मतलब गिल्टी माइंड, गिल्टी एक्ट। तो मर्डर हैज टू कंपोनेंट, एक होता है गिल्टी माइंड and guilty act, planned murder, that is 103 BNS है। 116 क्या है? 116 है ग्रीवस हर्ट। 106 क्या है? मेडिकल नेग्लिजेंस है। सो आंसर क्या है बताओ? 124 है, 124। C is the best answer. Good, हो गया, ठीक है। प्रीवियसली क्या था? 326 A and B। Sixth question. It is punishable under dash clause of 116. So injury है इसमें, corneal injury is there. So there is a sharp force trauma, some sharp object entering his cornea, damaging his corneal stroma, which can lead to permanent vision loss because of corneal opacity. Whenever word corneal opacity, that is definitely grievous hurt है। कौन सा क्लास में आता है? क्लास 1 बताओ, क्लास 2, क्लास 3 एंड क्लास 4। सो आंसर है क्लास 2। कैसे याद रखना? याद रखना 2 eyes, that is the second clause। 3 parts of the ear, clause number 3। member, clause number 5। power star, that is clause number 5। clause number 6, sixth sense, head or face। clause number 7, fracture है। clause number 8, endangers life। clause number 1, that is emasculation, male। ठीक है? yes, clause number 2 है। attempt to murder is punishable under। murder मतलब homicide है with the guilty mind and guilty act। there are many cases like curry cyanide case is a very famous case of murder। curry cyanide, where the cyanide was mixed with the curry, the fish curry given to the in-laws। In that case, very famous case of curry cyanide, the accused and the culprit killed more than 5 people by mixing one of the ideal homicidal agent, cyanide। So cyanide is definitely a dangerous agent। So there is a planning, that means that shows guilty mind, and the act, guilty mind and guilty act, that is basically murder। attempt to murder, attempt to murder, murder difference is, in murder there is a death of the person, in attempt to murder there is no death of the person। so difference क्या है? death। आंसर क्या बताओ? आंसर है 108 लिखा है, 109 लिखा है। yes, 109 is the correct answer। 109, that is the correct answer। good, many answered। 103, that is the murder है। 116 is grievous hurt, and 108 is not required for your exam। You just go through this। so this is very important table, commonly asked in the exam। धारा 100, that is basically गैर हत्या मतलब culpable homicide, culpable homicide। धारा 101 हत्या, हत्या मतलब मर्डर। जिस व्यक्ति की मृत्यु का इरादा था उसके अलावा किसी अन्य व्यक्ति की मृत्यु कारित करके, दैट इज बेसिकली 102। 103 क्या है? हत्या के लिए सजा, दैट इज पनिशमेंट फॉर मर्डर। So what is the punishment in murder? Yes guys, what is the punishment in murder? हत्या के लिए क्या सजा हो सकता है? धनंजय, मानक दत्ता, like example curry cyanide case or Nirbhaya case. What is the punishment in case of murder? When it is proved, the punishment can be death sentence. That is the highest punishment in case of murder. Or it is life imprisonment. That means entire life in jail. 104, that is not required. 106, लापरवाही. लापरवाही से मौत का कारण, मतलब medical negligence. Death due to negligence of surgeon, gynecologist. Death due to causing some wrong drug. Then it is 106, लापरवाही से मौत. ठीक है? Life sentence, death sentence. Good, many answering. That's okay. चलो हो गया. Then 108. 108 याद रखना, आत्महत्या के लिए उकसाना. आत्महत्या, abatement for suicide. So abatement, like doing psychological torture or some comments, bad comments. So that can lead to depression and death of the male or female. Abatement to suicide, basically that is 108. So again the punishment is minimum 10 years. 109, हत्या का प्रयास, attempt to murder. 110 is not required. ठीक है? 116 definitely required. गंभीर चोट, एक grievous hurt है. 114 simple hurt है, that is चोट पहुंचाना. Voluntarily causing simple hurt, स्वेच्छा से चोट पहुंचाना, that is 115. स्वेच्छा से गंभीर चोट पहुंचाना, that is basically 117. So all these are very, very commonly asked in the exam. ठीक है? What is the commonest method of suicide in India? Yes, guys? What is the commonest method of suicide in India? The answer is hanging. Abatement to suicide, याद रखना, 108, figure of 8, 108. That is आत्महत्या के लिए उकसाना. Good, that's great. चलो, next question. Voluntarily causing grievous hurt. Options है, 116 लिखा है, 117 है, 115 है, 114 है. So try to answer. 114 already I said hurt है, चोट है, simple चोट है. 115 voluntarily causing hurt है. 116 grievous hurt है. Voluntarily causing grievous hurt, that is VGH. That is basically 117. So answer है 117. Okay, Manak Datta, very good. Good answer. Then, following are caused by blunt force trauma except blunt force. Like example, road traffic accident, stone, lathi, cricket bat, cricket ball. So any surface or any weapon which has blunt ends, not the sharp end, not the pointed end, we call it as blunt force. So blunt force can lead to abrasion. Yes, abrasion, bruise, laceration, but harakiri is a suicidal stab wound. So whenever word stab, sharp force. So answer है harakiri. Good. Again, types of abrasion commonly asked, guys. After the class, go through types of abrasion. स्क्रैच अब्रेशन है, ग्रेज अब्रेशन, प्रेशर अब्रेशन, then imprint abrasion. So there are 4 types of abrasion. Which is the commonest abrasion in road traffic accident? Yes, can you answer, guys? Which is the commonest abrasion in post-mortem examination in road traffic accident? Options है scratch, graze, pressure, imprint. बताओ बताओ जल्दी बताओ. So the answer is graze abrasion or brush burn, which is the commonest abrasion. Then आता है bruise. Bruise मतलब contusion है. So contusion can be superficial contusion. We call it as dermal bruise or deep contusion. Tram track bruise. We call it as migratory sign. Sixpenny bruise. So the bruise is basically because of the rupture of the blood vessel, extravasation of blood from the blood vessel into the subcutaneous tissue. There are many types. The color changes of bruise, very commonly asked. So mnemonic है RBBGY. Color changes. So red color when it is fresh. Up to 3 days, blue color. 4th day, brown color. 5 to 6 day, green color. 7 to 12 day, yellow color. So this is the color change. All of you write RBBGA is equal to bruise. So write this in chat box. RBBGY. सब लिखो. R मतलब रेड है 1 day, ब्लू मतलब 3rd day है, ब्लैक that is brown that is 4th day है, 5 to 6 that is the green color है, yellow 7 to 12 days है. Again artificial bruise, 3 marks question. The bruise which is created artificially by using plant poison, like example calotropis, semicarpus anacardium, ठीक है, Plumbago rosea, that is we call it as artificial bruise where color changes are absent. Okay, so RBBGY सबको लिखना है, लिखो. Yes, good. Laceration. Laceration में आता है 4 types. 4 types क्या है? एक होता है split laceration, stretch laceration, cut laceration, tear laceration. One more है avulsed laceration. Avulsed. Can anyone tell me what is the feature of avulsed laceration? In avulsed laceration, there are some important features. What are they? The split laceration is commonly seen over the bony prominences, especially over the face, that is face, head or face, iliac crest, tibia, fibula, medial malleolus. So wherever there is a bony prominence, you will see split laceration, incise looking laceration. In stretch laceration, when there is a pull is there along with the pressure. Cut laceration, that is a misnomer, that is not normally used in forensic medicine. Tear laceration, it is usually caused by the semi-sharp object, like example broken bottles and all. In avulsed laceration, there are some findings. What are they? Can anyone tell me? Very good. So Manak Datta cricket answered, sir, इसमें होता है fleeing. Fleeing होता है एक. Or there can be amputation. Or there can be deglowing. So 3 important feature. Fleeing होता है, okay, amputation and deglowing. Good. So then 1 or 2 points about the sharp force. In sharp force में आता है stab wound and incised wound. In incised wound, again there are three types. Okay, one is penetrating, perforating, and punctured. So basically in stab wound. Incised wound can be cutthroat injury, suicidal cutthroat and homicidal cutthroat injury, that is commonly asked 10 marks question in your exam. So that's a different topic, you can just go through that. Okay, good. Okay. Now is it clear, guys? So Harakiri is also known as Sepoku. So this is MCQ. So it is practiced in Japan by Japanese samurai. So it's a method of suicidal death where they will place some stab wound over the right side of the abdomen from right to the left, so that there is nothing but belly cutting. So when there is a belly cutting, there is a cutting of the blood vessel. As you know, mesenteric blood vessels, the blood vessels supplying the intestine. So when they rupture, there can be sudden bleeding. So that can be cardiovascular collapse and death. Sudden shock that occurs and the person dies in few seconds. इसको बोलते हैं seppuku, also known as harakiri. It is also known as zigai also. Okay, zigai, that is in females. Okay, so ठीक है. And the last question, the manner of harakiri: suicidal, homicidal, accidental, fabricated. So harakiri, answer is suicidal. Homicidal, one of the commonest method is firearm method, firearm injury. Accidental, in case of road traffic accident है. Fabricated, that is self-induced है. Self-induced injuries है. So usually over the accessible body parts. So suicidal, that is in Japan. So which causes cardiovascular collapse, cardiac collapse. So BP decreases suddenly and death occurs. Answer है E. Okay. So this is about the 10 important questions. So that can be asked in your exam. Yes, guys. So what is your score? All of you, let me know your score. Yes, Rakesh, what is your score? Manak Datta? Manak? Dhananjay? Cricket? And we have, yeah, yes, what is your score? Yes, Dhananjay got 9. The score of Dhananjay is 9 out of 10. Manak Datta got 9. Yes, congratulations all of you. You all cleared your exam. That is more than 10. That is more than 5. So out of 10, congratulations. Great. So this completes your today's session. So if you have any doubt, you can ask me for next 5-10 minutes. So Dhananjay, there is no other way. You need to read. You need to understand. So that is the only way to remember BNS. So some BNS you can remember with the help of some mnemonics. Like example 80 BNS, 80 lakh dowry, 106 laparwahi and death, 116 grievous hurt. So rest all 103 murder, 103 matlab very serious case, murder case, 109 attempt to murder. So padna padega, so 2-3 बार padna hi padega, then only you will remember. Yes, we will do that. All the acts. Yes, in upcoming classes, we will plan some important acts, that is basically TOTA, Transplantation of Human Organ and Tissues Act, Consumer Protection Act, NDPS Act, MTP Act, PCPNDT Act. So we will do in upcoming classes. Don't worry. Just remind me, so we'll plan out some classes, especially targeting your acts. Upcoming days, at least one class in a week. We'll plan it out. Any book is fine. Bardale is also good. Reddy, Ignatius, Bishwas. Any one book you can refer. That is updated version. And along with our classroom notes and video lecture, that is more than sufficient. And anyway, we are doing every day one case of Booth Bungalow series and Filmy Funda series. So you can learn so many things with the help of Filmy Funda series. Okay, few things we cannot enact and show you in the classes. So that's why we have selected few video clips from the different movies. So that will help you to understand. So that's it about the today's lecture. So just to summarize today's lecture, so that is a grievous hurt, one very commonly asked question. What is grievous hurt? There are 8 clauses are there. Then 114, 115, 116, 117, 118. The clause 1, remember emasculation. The clause 2, 2 eyes, that is related to the permanent privation of sight of either eye. The clause 3, that is the ear hai, outer ear, inner ear and middle ear, 3 parts hai. So clause number 3. Clause 4, that is basically a member or a joint. Clause 5, remember 5 fingers, power star, that is permanent privation of power of a member or joint. Then the clause 6, that is the 6th sense, head or face. 7th, fracture or dislocation of tooth hai. 8th, याद रखना, endangers life. 15 days, unable to do ordinary pursuit. ठीक है? So याद रखना 1103 है punishment for murder. Murder में आता है 2 चीजें, एक है guilty mind and guilty act. 109 है attempt to murder. So this completes today's lecture. We'll come up with some more important topics in upcoming classes. Thank you all.